Congratulations! You made yourself a doctor's appointment and you've just taken the first step towards maintaining happy, healthy vision. Way to go! Now before you leave for your appointment, it may be helpful to bring along the following information. Your health insurance info as well as a valid photo ID, any glasses or contact lenses that you currently wear as well as the prescription if you have them, a list of medications, allergies or other health conditions, information on any history of eye disease in the family, and perhaps a notepad and a pen to write down any questions that you may have for the doctor. Prior to your appointment, it may also be a good idea to ask the doctor if you'll be able to drive yourself home, as certain procedures that the doctor can perform may temporarily distort your vision, so it may be a good idea to have a friend or a relative drive you to your appointment. But more on that later. Now that you're here, let's talk a little bit about what you can likely expect from your visit and how you can make the most of your time with the doctor today. First, let's get ready for some basic questions. How long has it been since your last eye exam? How are you seeing today? Any complaints about your vision? Blurriness, trouble focusing in the near or far, halos, trouble driving at night? If you wear glasses or contact lenses, are you happy with your prescription? Any eye symptoms that you're concerned about? Fuzzy spots, tunnel vision, floaters, redness, dryness? Any pain or discomfort in your eyes? Itching, burning, double vision, headaches, flashes of light? Family medical history? Any eye diseases in the family? Anything else that you are unsure or concerned about? Don't be afraid to be as honest as possible during these questions. Remember, they're your eyes. If something is bothering you, speak up. Your doctor will likely thank you for making her job that much easier. A typical comprehensive eye exam here in the US is designed to check your vision and to examine the appearance and function of all parts of your eyes. Now, exams may vary slightly, but they will almost always contain some variation of the following procedures. A review of your case history, a visual acuity assessment both in the near and the far, tests to check eye mobility and alignment, visual field test to check your peripheral vision, a refractive assessment, a slit lamp examination, tests to check your eye pressure, and a retinal examination. So let's talk a little bit more about what each of these procedures will look like, what they screen for, and why they are important to your overall eye health. Remember, if at any time you have any questions about a particular test or procedure, don't be afraid to ask. As we mentioned earlier, your visit will likely begin with a series of questions about your medical history. And here you'll have an opportunity to voice any complaints or concerns that you may be having about your eyes. Sometimes some of these initial questions and screening procedures will be performed by a medical technician or an assistant prior to meeting the doctor. However, the information you provide can be very beneficial for the doctor in helping to determine which tests or procedures would be beneficial. So again, don't be afraid to speak up, and if you have a question, just ask. A visual acuity assessment. You're probably familiar with this one. This test measures how clearly you see with your habitual vision. You'll be asked to stand at a certain distance from an eye chart and to identify certain letters or symbols printed on the chart. The lowest line that you can comfortably read is known as your visual acuity and is normally noted as 20/20, 20/30, 20/40, etc. These tests can be performed monocularly or binocularly. The test can also be performed up close using a reading card to assess your reading vision. So again, the results of the visual acuity test are normally noted as 20/20, 20/30, 20/40, etc. But what do those numbers really mean anyway? Well, it's really quite simple. 20/20, generally considered to be good vision, just means that you would have to stand 20 feet away to read what somebody with good vision could also read from 20 feet away. 20/30, on the other hand, or slightly worse, would mean that you would need to stand 20 feet away to read what somebody with good vision could read from 30 feet away, etc., etc., etc. Eye mobility tests. These are a series of tests designed to evaluate the muscles that control eye movement. The doctor may ask you to follow a moving object, such as a pen or a small light, with your eyes, and by watching your eye movements, she can look for signs of muscle weakness, poor control, or misalignment. The doctor may also shine some small lights in your eyes to check for pupil reflex. Probably a little nicer than that, though. A visual field test. The visual field is the full extent of what you can see to the sides without moving your eyes. The visual field helps determine if you have any difficulty seeing in any areas of your overall vision. If you aren't able to see in certain areas, noting the pattern of your visual field loss may help the doctor determine or diagnose certain eye conditions. Refraction. Now, if you'll remember from your high school physics class, light waves bend or refract when they pass from one medium into another. Now, light waves are bent as they pass from the air through the cornea and the lens of your eye so that they are focused squarely on the retina, which is the photosensitive layer of cells in the back of your eye. From there, it is transferred into these electrochemical signals which travel through the optic nerve into the brain, where it is transferred into visual perception. If light waves don't naturally focus perfectly on the back of the eye, on the retina, you have what is called a refractive error. And it could mean that you might need some eyeglasses, contact lenses, or refractive surgery in order to see clearly. Assessment of your refractive error will help the doctor determine a prescription for corrective lenses that will give you the most comfortable vision. In order to screen for refractive error, your doctor may use a device called an autorefractor to estimate a prescription for your eyeglasses or your contact lenses. She may also use a technique called retinoscopy. In this procedure, the doctor will shine a light in your eyes and will measure the refractive error by evaluating the movement of the light reflected from the retina back through the pupil. Your doctor would then likely fine-tune this initial refractive assessment by having you look through some lenses at an eye chart to see how they affect your visual acuity. This fine-tuning process is typically conducted using a device called a phoropter, which contains wheels of different lenses that the doctor can quickly cycle through to see how they affect your visual acuity. By asking you to provide input on which combination of lenses gives you the sharpest vision, the doctor can determine the optimal prescription for this patient's unique preference. This process may also be completed using some trial frames and lenses, just like these, which help to simulate the desired prescription. And they also just look really cool. A slit lamp examination. A slit lamp is essentially a microscope that magnifies and illuminates the front part of your eyes with an intense line of light. The doctor will use this device to examine the front part of your eyes for any abnormalities. He'll check the eyelids, the eyelashes, the cornea, the iris, the lens, and the fluid chamber between the cornea and the iris. Sometimes during this process, the doctor will use a fluorescent dye to help reveal any damaged cells or abnormalities. Eye pressure. Tonometry is a technique used to measure the fluid pressure inside your eye, often called intraocular pressure. If the pressure inside your eyes becomes too high, it can put you at risk for glaucoma, which can eventually damage the optic nerve and could lead to vision loss. There are several methods used to measure intraocular pressure, but one of the most common methods is called non-contact tonometry. This method uses a puff of air to estimate the pressure inside your eye. You'll feel a momentary pulse of air on your eye, which can be a little startling, but it's better than glaucoma. And finally, a retinal examination. A retinal examination, sometimes called ophthalmoscopy, or fundoscopy, allows your doctor to evaluate the health of the back of the eye, including the retina, the optic disc, and the underlying blood vessels which nourish the retina. Sometimes during a retinal exam, the doctor will administer eye drops to dilate your pupils so that they can more easily see the inside of the eye. A dilation isn't always necessary, but sometimes if it is, it can impair your ability to drive home, as your eyes will be dilated and you will see things quite blurry. If this is the case, you may want to ask a friend or a relative to help drive you home after your appointment. There are several methods of examining the retina, and some include a direct exam where your doctor will use an ophthalmoscope to shine a beam of light through your pupil to look at the back of the eye, a fundus cam, which essentially just takes a picture of the back of your eye, or an indirect exam where the doctor mounts a giant light on their forehead with the aid of a condensing lens to look inside the eye, can see the structures in the back of the eye in great detail and in 3 dimensions. At the end of your exam, you and your doctor will discuss the results of all testing, including an assessment of your vision, your risk for eye disease, and preventative measures you can take to protect your vision. Normal results from an eye exam include 20/20 vision, good peripheral vision, ability to distinguish various colors, normal appearing structures of the external parts of the eye, absence of cataract, glaucoma, or any retinal disorders such as macular degeneration. And remember, this is your appointment. If you ever have any questions or concerns about any of the procedures being done, just ask.